reduce the spread of COVID-19. The protocols have several core principles. If you are at risk or if you're sick, you should stay at home. You should frequently sanitize your hands. You should maintain safe distances from others when you do go out. And when you do go out, you should wear a face covering or a face mask. These strategies have proven to be effective in stopping the spread of COVID-19. Fifth, I've said all along that if the positivity rate or the hospitalization rate increase too much, we have strategies to reduce the spread of COVID-19 without having to return to stay-at-home policies. Sixth, closing down Texas again will always be the last option. Now, with that context, I want to review several key data points. They are shown in 3 graphs that I'm providing today. First is a graph showing the daily number of people testing positive. In the last half of May, Texas averaged about 1,500 positive cases a day. In the past 5 days in June, we've averaged more than 3,500 cases a day. Second is a graph showing the rise in the positivity rate. The positivity rate has gone from about 4.5% in late May to almost 9% today. Last is a graph showing the rise in hospitalizations. Hospitalizations for COVID-19 averaged just over 1,600 a day in the latter part of May. In the last 4 or 5 days, hospitalizations have averaged more than 3,200 a day. To state the obvious, COVID-19 is now spreading at an unacceptable rate in Texas.
That's an understatement. That is an understatement. That is a man confronting reality and being forced to knuckle under. Reality does not care one iota about your ideologies. And in doing so, meaning having to deal with real things, despite what he wanted, he had to make this video. This was like last week. I'm going to show you numbers today that is even going to be shocking to that governor if I could tell him back then what it was going to look like in just 2 weeks. It's that bad that this Republican governor of Texas is breaking from Trump and has started to close down parts of Texas again because he's not been able to deal with it. Abbott, you must understand, Governor Abbott pursued one of the most vicious and ruthless reopening schedules of any of the other states, even going so far as to not taking the step of getting people to wear masks, meaning putting that order through, like the most modest of steps. But going further than that, not allowing local governments to do the same, not until last week. Seriously. Right now, Texas is seeing a resurgence of this virus. This is what Texas looks like today. Look at these numbers. 6,584 new cases. What was he saying? 3,000 in that video? Again, that was like last week. This is double. Here are the deaths. 29 deaths today. Yesterday, 46. He didn't even go that route in explaining how many people have been dying from that virus. To put this in real terms, this virus is once again out of control in Texas. Cases have climbed rapidly. On Thursday, Texas saw another record number of cases, 5,996, as well as hospitalizations, 4,739, meaning hospitalizations. The hospitalizations number set a record for the 14th straight day. Now, understand what that means and why they're explaining hospitalizations. They sort of put a blurb behind that. Donald Trump has been making the argument that the reason that you've seen the spike in cases has less to do with a real material difference in the number of cases from the standpoint of COVID-19, but more in the accuracy of testing. Meaning because we're testing more, we're getting more positive tests. That doesn't work. Hospitalizations wouldn't change for that. Meaning even if you had a phenomenal number of new testing because you were testing everybody in the country, the The hospitalizations wouldn't change unless you had an increase in the cases themselves, meaning a real material difference increase in the number of people who were being affected and how dramatically those people were being affected. No, this is a real material increase, a significant surge, a spike in the number of people who was infected, doubling just over the course of the last week or so. Abbott cited Texas' large hospital capacity and availability of respirators, but many hospitals in Texas' big cities have reported crowded intensive care units in recent days, and some cities have begun reviving plans to treat patients at convention centers and stadiums. Do you hear what I'm telling you? Like, the number of cases in the hospitals have gotten so large that the hospitals are not having the capacity to deal with those cases. This is, by the way, what people like me was bitching and screaming about for the last month or so when these guys were saying we need to open the economy, we need to open the economy. That virus does not give one shit about your funny money that doesn't really exist and your political space that also is an imaginary thing. The virus is real. Human beings are real. And as those two real things intersect, bad outcomes happen with those real things, human beings die and suffer. And your question is whether or not us as human beings in the capacities that we have at our disposal, we use those capacities to prevent this from happening. And that answer, decidedly based on this, is no. We cared more about the finances. We cared more about the economic space. We cared more about forcing those workers back into situations that weren't safe and allowing the public to also follow behind. Yes, the public wanted to get back into the flow of things. Everybody wanted to get back into the flow of things. I personally wanted a pedicure or a spa treatment. I want those things. By the same token, I recognize that it may take months before we are able to safely encounter that stuff. Because at the end of the day, those are luxuries, and those luxuries can be put to the side when there are real priorities that need to be dealt with. They decided to deal instead of with the highest of priorities, human life, human health, and human happiness. Instead, they decided to ensure the owner class can continue to make their profits, fundamentally missing the point that the handmaidens of fate in reality don't care about how you feel about that stuff. Those are things that you have to grapple with. And because you did not grapple with those things earnestly and rationally, at least from the standpoint of human health, happiness, and life, you've made bad choices. And you and your state, unfortunately, will pay for your bad choices. Welcome to the Soapbox. My name is Jamarl Thomas. This is the Progressive Soapbox. Guys, if you dig this content, please like, share, and subscribe. You can always support this content through PayPal and Patreon. Fate makes a man knuckle under. That's basically what this is. Fate makes a man knuckle under. Governor Greg Abbott on Friday took his most dramatic action yet to respond to the post-reopening coronavirus surge in Texas, shutting bars back down and scaling back restaurant capacity to 50%. He also shut down river rafting trips, which have been blamed for the swift rise in cases in Hays County, and banned outdoor gatherings if over 100 people unless local officials approve. At this time, it is clear that the rise in cases is largely driven by certain types of activities, including Texans congregating in bars, Abbott said in a news release. The actions in this executive order are essential to our mission to swiftly contain this virus in the interest of public health. Bars must close at noon on Friday, and the reduction in the restaurant capacity takes effect Monday. Before Abbott's announcement Friday, bars were able to operate at 50% capacity and restaurants at 75% capacity. As for outdoor gatherings, Abbott's decision on Friday represents his second adjustment in that category this week. That's how fast it's been moving. Think about that. Your country, your state has fucked up so royally that a virus that had numbers that were going down and trending down have now hit record numbers. You forget that the issue with the economy is not the economy. Yes, it is, but it's not. The issue with the economy is that a virus was running through your society and was going to end up killing a lot of people, which would have prevented those people from going to work because they would have been dead potentially or ill. In order to stop that realization and that spread in those particular activities, you told people to stay home. Now, what the government should have did was basically federalize everything, paid everything for the time being. Money isn't real. Deal with that after the fact, but in the intervening time, yeah, make people whole, ensure that people continue to get their paychecks, ensure that those businesses are able to keep afloat. The larger companies, leave them to their devices. Amazon doesn't need our help. But you understand my point. There were ways that the federal government could have dealt with this that would have credibly dealt with people's need for resources. Instead, you put people in this miserable situation of having to choose between going to work in an environment that may kill you versus being whole at home. And fact of the matter is there are many jobs where people can't work remotely. Meaning many of the jobs, especially the ones that don't pay all that well, deal with customer service. And customer service just so happened to be part of the job that deals directly with the public. It's in the name. We didn't behave rationally. Abbott on Tuesday gave local governments the choice to place restrictions on outdoor gatherings for over 100 people after the previously setting the threshold at over 500 people. Now outdoor gatherings over 100 people are prohibited unless local officials explicitly approve of them. State officials have noted that the case numbers in Texas began to increase around Memorial Day weekend and have expressed worry about big public gatherings for the 4th of July. A man knuckles under to reality itself. You've gotten a lot of people killed, dude. That's the reality. Texas has gotten to the point where they were putting people in children's hospitals because the hospitals were running out of capacity. And now these guys are talking about taking a huge convention center and just putting a bunch of beds in there in order to compensate for what they consider to be an inadequacy on their end of being able to deal with this crisis. He wanted to open businesses. You got your businesses open. Now you're shutting some of those down. From a standpoint of Florida, this is Florida caseload. And here we are, records again. 5,000 cases yesterday. 5,500 day before. 3,000 day before that. 2,900, might as well say 3,000 day before that. But I think you can see the trend line. It is going up, just like the trend line was going up in Texas. Death toll, 46 new deaths. 2 days ago, 65 new deaths. Again, I think you can see the trend line. The highest case of new deaths in Florida was 83. Do you think you're going to hit that number if that number continues to rise? So what is DeSantis doing? Now, DeSantis has stayed with Trump. DeSantis, despite the calls from reality itself to deal rationally with ensuring human beings are healthy, he has instead decided to pursue the reopening schedule. And in doing so, basically staying arm in arm with Trump, setting his state on fire. He has done one thing, though. DeSantis has basically had bars closed down. Well, not closed down, not sell alcohol. Now, you understand what this effect is. He doesn't want to say, I'm going to shut the bars down. That's too dramatic for him. So instead, he wants to say, we're not going to sell alcohol at those bars. Well, why? Because if those people are going to a bar, they're going to a bar for alcohol. And if the alcohol is not going to be sold at those bars, you create a disincentive from those people to go there. He does not just want to say bars are closed. He wants to go about it in this kind of squirrely, ridiculous way. Texas and Florida clamped down on the bars again on Friday in the biggest retreat yet amid a surge across South and West that has sent numbers of confirmed new coronavirus infections per day in the United States to an all-time high of 40,000. Texas Governor Abbott ordered bars closed right while Florida banned alcohol consumption at such establishments. Look, he doesn't want to basically say and own, I'm shutting down these bars. He's a Republican governor. He's pushed for this notion of reopening the economy. He's standing arm in arm with Trump. He doesn't want to deviate. So he's going about it in a squirrely way. It's reality. I know some people are dicey about this, meaning they don't necessarily like being in the house. I don't either. So it's not just you. I think my medical history informs me in this. I've been told by a doctor one time, he says, you have two options. You can go into the hospital or you can go into the hospital. Because the fact of the matter is, the outcome sometimes of not doing something is so dramatically worse than what it would be if you bear the indignity and the pain of the moment in dealing with it. Basically, he's saying you can die or you can go to the hospital. Those are your options. You choose. I chose to go to the hospital. Do you realize there have been times where I've been stuck in the hospital where I haven't been able to eat for like 40 days, where they would give lipids and all of these other chemicals and whatnot in order to kind of keep you going without food being in your system. Shit happens. And sometimes that shit happens on a large scale where you just have to deal with the issues of the moment. If he would have dealt with the issues of the moment in the way he would have supposed to, this state would have been able to reopen fully, much more faster in capacity, just by ensuring that your interest and your priority is health and human happiness. You didn't do that. So now it's possible that you're going to end up being forced to go back into some level of a larger shutdown. It's been 2 weeks and you basically double your cases. What is it going to look like in 2 more weeks? These cases expand, in some cases exponentially. Donald Trump had basically was going to get rid of, and at this point, as far as I know, he still is, the various state or federally run facilities, including in Texas. As you know, the meetings, the Trump task force hasn't met in 2 months. Well, they met today. Basically, Trump is under a massive amount of pressure because regardless of what he wants to say about these cases and the spikes being due to some kind of testing jump, the reality of it is he knows his administration, whether or not they would say no, and his sins are being visited on all of these states as they try to push forward this economic development, and that path of action is basically failing to the realistic needs in the moment. Basically, how do we preserve human health? And if you want to preserve the economy, how do you do that in a way that doesn't necessarily force workers to go back into a hazardous situation? And for that matter, keep people whole if they do indeed need to be out of work. Texas and Florida, 2 states saddled with a large death toll and people ill. Like, share, and subscribe. Thanks all.